Let me tell you what you might expect when you have your hip replaced. Let's say you've got osteoarthritis. You would be assessed prior to surgery, and assuming you're fit to be treated in the private sector, there would be an admission day, and you would be assessed by the surgeon and the anaesthetist on the day of surgery, and you have a choice of anaesthetics. You then come in for the surgery, and a typical hip replacement will take about an hour. The choice of implant is decided by the surgeon, but normally I've agreed that with you in advance in the outpatient discussion, the choice of ceramic or metal or whatever the choices would be for that particular implant. Following surgery, the recovery is normally fairly swift. Physiotherapy input is essential because the important thing about having surgery on your hip is that you get moving fairly quickly, and that reduces the risk of complications. Having said that, all the complications are considered prior to surgery, and we take the necessary precautions to minimise trouble. And for most people, hip replacement is a straightforward procedure. The pain after the surgery isn't too bad, and we have plenty of pain relief options to help you. You'd be typically in hospital for 1 day and then home with follow-up arrangements made, including physiotherapy. And there would be a progression of your mobility, walking, stair climbing, etc., as well as strengthening the muscles. And whether you're a young hip replacement patient or an older hip replacement patient, the same process normally happens, but it would be tailored to your individual needs as necessary. After about 6 weeks, I would review you, check that the wound has healed, that you've got good movement in the hip, that all the post-operative x-rays are fine, and then that might be the time when I could discharge you back to your doctor. The risks of hip replacement surgery are well known. They include infection, bleeding and thrombosis for the majority of people. Those are things that we prevent with body washing, antibiotics, care during the surgery to minimise blood loss, and also drugs to prevent thrombosis, as well as stockings and exercises which are helpful in reducing that risk. There are other complications like nerve injuries and dislocation of the hip, but they're incredibly rare. And for the most part, although I mention them, they're not of practical concern. So for the majority of patients, it's straightforward. Healing after surgery is fairly straightforward as well. I have a particular technique for closing my wounds, and that's resulting in good healing, which is important. And after about 2 weeks, the wound is nicely healed, and then steadily you'll get stronger and more flexible with time. Typically, recovery times are up to about 6 weeks. Occasionally it can go on to nearly 12 weeks for a really complex case, but when you consider the size of the surgery that's being done and the life-changing element, even if it's 3 months recovery, that's pretty good. Physiotherapy input and your commitment to doing the exercises is valuable, so we have to work together on this.